I was really happy to be invited to be a part of this project. I think as an academic and a researcher in implementation science, I certainly have an interest in social media and the uses to which it can be put. In my field, I'm interested in how social media can be used to encourage practice change, to have an opportunity to work with Neil Seaman and the rest of the Ginger Council and that research team was definitely of interest because it offered a new perspective into exploring social media purposes for how people are talking about their diseases, their experience of being patients, and not something I had considered previously. And the project itself, I think, expands all of our awareness as to the uses of social media in healthcare, in mental health care, and more broadly across health promotion. So that we can better understand, really where we can get to, how it actually can be used to its greatest effect. In this particular instance, in this project, examining how listening to the voices of people and their experiences with healthcare can be put to good use and value by the healthcare organizations is a very interesting question to explore. The added value of this project is really to offer examples of potential, examples through case study, so that other organizations who have an interest in this area don't need to reinvent the wheel, don't need to start from scratch, can learn from the experiences and the processes and policies and procedures that other organizations have already taken into consideration. I guess one of the added value pieces of this project is not only what it provides in terms of how-to and potential and connections to organizations who have tried this, but I think it might open the doors for people to ask empirical questions and actually study the social media uses in healthcare organizations beyond what's already been accomplished. So if we look at how healthcare organizations are using social media at the moment, for the most part, they're for educational purposes. It's considered an add-on to their communication toolkit, pushing out information and for all to see. It's also being used for fundraising purposes as well. I think the more sophisticated uses of now closing the loop between what we're hearing and how we use that information in a healthcare organization is an empirical question, and also one that we can start to explore in the way we have done in this project through case study, helping to shape that journey for some organizations and think through what's valuable, what are the tricky, sticky issues that we need to think through ethically. So perhaps one place we can venture then is how do we study this so that we have some evidence to back up the usage and utility of social media for quality and for really informing our decisions as healthcare providers. We've been exploring social media probably for about 5 or 6 years. We were maybe one of the first adopters from the perspective of research in mental health care, which is my focus. For the last 10 years, I've been leading an initiative for the Ministry of Children and Youth Services that supports the practitioners' use of an outcome measurement tool that essentially assesses whether kids improve as a result of the services they receive in mental health. And we had been supporting mental health practitioners for the last decade in learning how to use this tool and how to incorporate it into their everyday practice. It's been challenging. In keeping with the modern times and the availability of social media, we explored how we could develop a virtual community of practice using a wiki with the over 6,000 practitioners across the province of Ontario who are users of this outcome tool. We have managed to grow our community. We've not managed to secure research funding to study whether we have accomplished anything in terms of collaboration amongst the people who actually hook into our wiki. What we had intended was for people in one part of the province to learn from the experiences of people in another part of the province. And we've not been able to demonstrate that that's happened as yet. I think where we've looked at statistics, or rather metrics for collaboration, we haven't been able to demonstrate that it's very high. And I think those are some of the real world challenges to trying to get people to collaborate in a virtual space who've not had an experience of doing so. And so it's one of the interesting differences, though, is that in working with practitioners who we're supporting to use a tool, it's not necessarily their first inclination to connect with other people who are doing the same thing. In the patient world, these people have an internal motivation to go to the web, to seek information, to share their stories, to hear the stories of others. And that's an internal motivation. When you're trying to motivate people externally to communicate and collaborate that way, you meet with different challenges. It's really setting a path that can be followed by other organizations, giving them connectors, giving them knowledge, and perhaps to some extent over time some tools in terms of what are some of the other policies that organizations have adopted that they may adapt for their own purposes.